As many know, Medicaid, Title 19 of the Social Security Act, provides health care to low-income Americans, long-term care to the elderly, and health services to people with disabilities. The provisions of the Act, or Sooner Care as it's called in Oklahoma, are delivered by the Oklahoma Health Care Authority, and Mike Fogerty, the executive director of the agency, is the person who keeps the organization together and through his vision and leadership gets it done for the state of Oklahoma and its citizens. Mike is a 1974 graduate of the University of Oklahoma School of Social Work, recently renamed the Ann and Henry Zero School of Social Work. He went through the school's administration and community planning track, and as many know, is a social worker who also happens to be a lawyer, not the other way around. And I hope I didn't steal your line. Okay. Mike is a member in good standing of the school's Board of Visitors. As a member and as an alum of the school, Mike has been instrumental in securing the school's endowed professorships in health and in mental health. And this has broadened our curriculum and refocused many of our programs. His close relationship with President Warren, he was his legislative aide, and his advocacy on the school's behalf have led to a gift to the school by the Ann and Henry Zero Family Foundation and a new building to be located at the corner of Brooks and Elm, and they've already started the process of asbestos rebatement and tearing it down. And oh yes, did I say that we are now the Ann and Henry Zero School of Social Work? At least that's what it says on my card. Okay.
How are you?
Within Oklahoma, Mike has managed to expand health coverage to children and families close to the poverty line and significantly above. He has reduced barriers to access through Sooner Ride, and he will be working to shape the nature of healthcare policy implementation at both the national and the state level through his involvement with the National Medicaid Association. We hope all of the graduates of the School of Social Work will be like Mike. Ladies and gentlemen, Mr. Mike Fogerty.
Every year, and you'll be proud to know that your fellow Boy Scout from Guthrie, Oklahoma, Don Sessions,
I know that man.
is the volunteer that is creating savings for people every year by volunteering to help people go through their Medicare Part D option and select the best prescription drug program for them and their prescriptions. And we think we ought to be serving 500 or 600 citizens in our community, and we think that would create $250,000 in savings, which is a lot in a small town, isn't it? It's going to be spent right back in that community. Are we on the right track? Are there other things that we ought to be looking at as a community to enable you to do managed care?
Oh, that's an impressive list. And the one thing that just comes to mind is just be the voice of reason. This is an emotional, let me tell you, this is about math. Remember how easy it was to pass the tobacco tax? You know why it was easy to pass the tobacco tax in this state? Because even though we hate it, only 25% of the adults in this state smoke. So we had 75% non-smokers voting for a tax on 25% of the population that did smoke. That's pretty good politics, isn't it, Cal?
Yeah, but the voters are smarter than the
They're noisy. Yeah, I understand. I understand. When you have 15% or 14% of your population without insurance, that means obviously you've got 85 or 86% that do have insurance. And that doesn't mean that everybody that has insurance is happy with it, because I guarantee you they're not. But the politics are very difficult. And when I hear the scare stuff, there are numbers that I haven't even mentioned yet. 55% of the people in the state of Oklahoma that have insurance have a public policy. They have the state employee health policy that's owned and operated by the state of Oklahoma. They have Sooner Care. They have federal programs that are they have Medicare, for crying out loud. That's a socialist conspiracy right there. Now, see, I'm going to get in trouble. So the reasonable mind, it seems to me, is one of the biggest contributions that you can make out in that community. So when people stand up in front of the crowd and try to stir up this scare stuff, you're going, whoa, wait. Who was it on TV not long ago that had their, by God, they didn't want the government messing with their Medicare programs. But great ideas. I think we've got time for one more, maybe, question. I see one from the faculty member in the back of that drove over here from Tulsa.
Yeah, that's right. So one of the challenges that I think maybe that Medicaid or student care doesn't address, right, is that increasingly we're understanding that our health is socially determined. And these are things that are largely not medical in nature, right? So, for example, I just talked to the PEDS social worker yesterday in the OU clinic, the PEDS clinic that sees 13,000 kids, most of them on Medicaid. She sees 372.
You mean Sooner Care? of course.
Sooner Care, I'm sorry.
Yeah.
372 kids she saw in 1 month. These are not Medicaid reimbursable services that they're seeing. These are social issues related to their health, right? Not anything that fits in our current framework around how we think about our health. And so I guess my question for you is, as we are starting to understand this more, and not just from a sociological perspective, but also now from a genetic perspective in terms of the influence on our social environment and how it may be actually changing our genes, our health, what do we do about that? What are other things outside of access to care and medical care in our state that you would suggest that would improve maybe the health of Oklahomans?
Well, thank you for the question. And it's always tempting, and when I'm in a room with people from the Department of Public Health, and there if we're not very careful, there seems to all become this competition. Is it about spending money for access to insurance, health care, or is it about spending money to educate the population? And Lord knows, it's got to be both. I mean, we need to be spending serious money. I participated in the OHIP project with the Health Insurance Improvement Program that's being headed up by the Health Department. And we came together in that process as partners saying, this isn't just about helping people buy health insurance. This is about educating people on what it means to quit smoking, what it means to go on a nutritiously sound diet, what it means to be active, what it means to get the kids off the couch occasionally, outside doing. So it's both. Let me just add to that. I don't know if you're familiar with some of the detail as we grow this medical home concept, and Oklahoma is one of the leaders in the nation. That is bigger than traditional health care. And right now, if a doctor, for example, wants to qualify for tier 2 or tier 3, which means more money, part of the consideration is, do you have a social worker in your office that has opportunities to interact with your patient panel, to talk about things like genetics and to talk about things like healthy lifestyle? And if you do, that's one of the things that gets you qualified for a higher reimbursement. So I think, there's two things we have to do. One, we have to recognize that we need a campaign. How many of you throw trash out the window of your car? How many of you did 40 years ago? I'm sorry. But I guarantee you, when I saw the ad about the third or fourth time of that Native American standing by that creek with a tear running down his eye because there was so much junk in the creek, I quit throwing stuff out of my car window. But it takes that kind of effective campaign to educate people and retrain us. And I'm sorry to confess that I threw my Sonic cup out the window. That's just it. So it takes both. It takes that, and it also takes a recognition that medical care isn't just done with a stethoscope. It's done with lots of tools and lots of professions beyond MDs and DOs. I think we're out of time. What a great day.